Yeah. Okay. Okay. Welcome, guys. Thank you for joining us today. Christy is so great to come and talk to us again. She talked to us with the Healthy series that she was so great to take part in and really drive it home. So we were really super grateful with all the knowledge that we learned from her. She has her own practice and has had for many, many, many years. So I was so happy when she reached out for the first time and asked to join the group. She said, I don't have COVID-19, but I think I can help. And she was absolutely right. We have learned so much from her these past months. So it's great to have her here on our Tableside chat. So welcome, Christy.
Thanks for having me. And I have to say also, I am so grateful for this group because in all of the other long hauler groups, if I gave any advice or weighed in, my comments would be deleted. I could not post. They just didn't want any other information other than what fits their narrative, which is really sad because they're missing out. I mean, we did a whole series and we talked about a lot of different aspects during the Healthy series. We went over the major systems: lung, heart, kidney. We did self-healing practices, which is like Qigong and more to increase function of the different organs. We talked about how a virus becomes latent and lifestyle for managing chronic conditions. I specialize in chronic complex cases. So a lot of my patients for the past 10 years are medical mysteries, people who have been cast aside by the conventional medical community because doctors can't figure out what's going on with them, chronic fatigue, so many different complex internal medicine cases, which gave me the insight, even though the long hauler situation is brand new, it's still chronic medicine and energy conservation and lifestyle, and the body doesn't change.
Okay. So at what point then, so you've been dealing with mysterious illnesses. So people come to you when the doctors say, we don't know. So then they land on your doorstep. So at what point, like, can you walk us through that moment when you thought, oh, wait, I can probably be beneficial to people recovering from COVID-19?
Oh, right away.
Why was that?
Because of first off, not only is my practice all chronic and complex, but also I love cold and flu and simple, what I used to call simple seasonal illnesses. So when you combine the two, and I was watching early on when this started back in February. I don't know, it just kind of didn't click that it was actually going to come here. And now we know that it was actually here before. So I was watching the Chinese doctors go into Wuhan because I knew from my education that they were brought in late on SARS. But we have textbooks that are since 250 AD was our first infectious illness pandemic textbook. So our medicine is specifically suited for this. And so I was watching just like, a nerd, like, wow, this is so cool. I get to watch this in real time. And they brought the doctors in this time instead of late. They brought them in right away. They brought the same team of TCM doctors that helped with SARS. So the medication for SARS that they ended up finding that worked is based on Chinese medicine. So they brought that same team in. And so we were watching it. We were getting the firsthand accounts from the doctors on the front lines. And they're fully integrated. See, here in the United States, it's conventional medicine or Western medicine and Eastern medicine. There, it's medicine. So you can go to a conventional hospital and do exactly what our hospitals do here. And they'll always have an Eastern medicine wing, even if it's not that active. Or you can go to the Chinese medicine hospital, which is where I studied in Nanjing. And there they are mostly TCM, but also incorporate Western medicine. So they do surgery, MRI, CT, oncology, pediatrics, but it's they might do surgery, but then they'll rehab you with Chinese medicine.
Okay, I got you. So they're all under one roof, one big umbrella, all under one roof, under everything.
So me as a student, when I went in and saw this, it was a real eye-opener on how it's not us versus them. It's what is the best tool for the job.
Mm-hmm.
And when it comes to something like this, hands down, vaccine, imaging, all of that, conventional medicine, without a doubt.
Mm-hmm. I love how you say that's the best tool for what's the best tool for the job. I love that. So what happens, for example, with a patient of yours? Like what's a day, like what's a general day if you get a COVID patient across from you? What are you doing? Are you looking for the best tool for the job? How does that look? Can you walk us through that?
Sure, absolutely, absolutely. So as you know, I'm in LA right now, and we have been in the fire. Before it was a lot of books and studying, or I was getting I got my first patient in early March. Mm-hmm. And then it was like 1 or 2 a month. And then as you know, time started going, then it was like 2, 3, then once a week. And then by the time December hit, it was every day, including Saturdays and Sundays. And it wasn't just one patient, it was every day was a full family, because it just runs through the house. So what do you want to talk about acute or?
Well, let's if you want to talk about acute, but most of us here are long haulers, so we're probably more interested in the what happens long term, because if they're on the internet and able to be with the group, I doubt they're in acute phase anymore.
Well, the thing about acute though is the one thing I will say that I've learned from the group that's helped me be better at acute is identifying the long haul issues that you all have. And I'm able to see them when they first develop, and I'm able to nip them in the bud quickly.
Okay.
So that is really important. Mm-hmm. So what happens with the long hauler is this is a very tricky multi-system pathogen, and it burrows. And the longer time goes, the more it burrows and it does destruction. So you have 2 issues going on. One, you have a latent pathogen. So that means that it can pop up in cycles, kind of like Lyme disease. It really does mimic a lot of Lyme. Herpes, right? Shingles. These are all latent pathogens. You may not see them for a while, then they pop back up and they come in cycles. So that's a latent pathogen. So what happens is if the body isn't able to clear it right away, in that, I call it the golden window, there's a very specific time in the beginning where you have to hit it really, really hard to clear it.
So what should we have did, like everybody in the group who are long COVIDs, what should we have done then differently in your
someone
opinion?
Like me, literally, because I don't know anything else. But that's like that ship sailed. Right. So like with the long hauler situation is you still have to address that, what we call hidden or trapped virus, because it's still there.
Right. So is there something that we could have done to help ourselves better? Is there something that we could have done to get through that window, to shut that window out?
It's really down to I don't think that someone without advanced knowledge can do it on their own.
No, not about doing it on their own or self-medicating, but I mean, you can't go take a Tylenol, because it's not about taking Tylenol, because I took a Tylenol. It's not about vitamins. I took vitamins. I was on zinc. So it's a multi-pronged approach.
The first step is that you have to rest and sleep a lot. And your only job is recovery. The second approach is, let's say you're under my care, because that's the only way I could talk about is what I do, is let's say someone comes in and it's mostly showing GI symptoms. So I know that it's in the GI. A lot of people in the acute, it's in the head, and then it'll move to the chest or the GI. So I have to do a diagnosis, see where is it, and then I create customized herbal formulas that go after it. I also use vitamins, but I want to talk to you about vitamins too, because I see a lot of acute patients coming in with the right vitamins, technically correct. They're on zinc, they're on quercetin, they're on NAC, they have melatonin, vitamin D, but they're not taking enough. So there's a difference between maintenance dose and therapeutic dose. But therapeutic dose has to be medically supervised.
Of course. Yes, absolutely. And everything we're saying in here, you need to first come to somebody like you, a professional. Absolutely.
Yeah, because,
we're not offering any advice.
No.
Advice
Everybody's different. So I could kind of tell, because it's been under fire this past month, I've had to work really, really fast. So I've had to be able to draw on my previous experience, which is a lot of cold and flu stuff. So I already know how to use these vitamins to get therapeutic dose. So a lot of people are taking the right stuff. It's just not enough. But also vitamins are not enough because you need stuff to specifically target the organ, where it is and how it moves. So as soon as you start seeing it move into the nervous system, that's an adjustment of herbs to go after the nervous system.
So that window is herbs. It's particular herbs, what professionals in your position, for example, have studied and knowledge about. That's what we missed.
It's herbs, it's vitamins, it's diet. Because if you're eating a ton of sugar and a ton of dairy, that's allowing an acidic environment. It's a multi-pronged approach.
Gotcha. Yeah.
It's more than just one thing. And it's really a lot of rest, because what a lot of people do is they get that day where they feel good and they're like, oh my gosh, I'm better. And they go out and do a bunch of stuff. And that little bit of energy that you built up just spent. So you want to treat it like an energy bank, even for long haulers, because you're still healing.
Right. Absolutely.
So it's like how I give the analogy to patients is like, you don't want to get that paycheck and go out and spend it on, whatever. You want to save and build up, because all of that money, all of that energy needs to go to healing.
I love that analogy. That's beautiful. Yes, absolutely. Absolutely. And so that's the acute. So when you first get sick, when you initially get sick. So what about us? So once you cross over, you've missed your window, you cross over into becoming a long COVID patient. That's a lot what we spoke about. That's how we, came into contact, and you gave us a lot of good advice during those sessions. So I know you're not going to outline everything here. You should have been at the sessions, but what's some things that you want to take away with this?
So you still have to address the pathogen, right? Because you don't want it burrowing or becoming latent, and we don't know, so that still has to happen. No matter what stage you're at, that still has to happen. Now with the long COVID, what I look at is I ask them what their acute phase was like. Because what we'll find is what was in the acute phase will still be trends in the long phase. And then the other thing is that you have to look at, there's two factors. One, the body's exhausted because it's gone through a battle. So you have to replenish and restore the body. The other thing is that you have to eliminate what is left of the pathogen. And then you also now are dealing with structural damage. Is there, fibrosis? Is there blood clotting? What is there? So in a perfect world, I'm going to get the person and they've been scanned and blood worked and labbed and all of those things. So we know exactly what we're dealing with. I ask for that. Ideally, that's what I want. Not everybody can get that, but that's like gold star, is you've been cleared. We know what's going on. And then we know, okay, we have lung damage. Okay, let's work on that. So, and then you just take it. And then what I do is I just make a hit list. Like, let's list it down. What's the number one thing that's the main symptom that is lowering your quality of life? And then we just make a list. Boom, 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 boom. And I see how I could tie the dots, because what you're dealing with is multiple organs, multiple systems. So you have to find that sweet spot where you can adjust multiple systems at the same time. Or sometimes it's like, we can deal with these three because these are connected. But once we get these down, then we're going to move to this and this, which is connected. Or maybe this one's not connected, it's on its own, and we're going to do something else for that. You know what I mean? So it's all about getting the person restored to the best that they can be. And, you know, the body is a repairing mechanism. Oh, I can't hear you.
I'm sorry. For me, one of the things that I learned from you is just how restorative the body is. And so not just the physical things, what we can do with it, but also mentally. And we discussed that a lot as well, like changing your mindset, rejecting that long haul label, and, you know, really doing something joyous for yourself, for example, that day, or something that's achievable. Can you elaborate on that a little bit?
Absolutely. So I'm going to use it in my in the words of my spiritual teacher, who's also a medical doctor and a Chinese medicine doctor. Mm-hmm. So he's pretty inclusive, and he talks about Shen Qi Jing. Shen is soul. That is the message. That is the thought. That is, you know, how you are emotionally handling things. Also, mm-hmm. Qi is the energy flow. That is how things are moving. So we had someone earlier in the group today talk about how she has these issues, but everything's clear. That means there's a Qi issue. The imaging can't pick it up yet, but the flow is off. Jing is the physical matter of getting the scan, doing surgery. That is where the tissues are involved. And those three models are what creates a human. So by the herbs, that's working on the energy part of it. The Jing is like your scans and your blood work. But the Shen is actually the driver of everything. So when you are of a negative mindset, like, I hate this COVID, I'm never going to get better, it's awful, I can't do this, blah, blah, blah. Your body's like, oh, okay, that's what we're going to do. Yeah. Because that's what you're telling me we're going to do. Oh, I'm a long hauler, so now I'm in it forever.
Yeah, yeah.
Yeah, that's the message you are giving yourselves. So I tell my patients, fake it till you make it. Every time you're in pain, it's like, absolutely. I'm getting better. Yes. I'm in pain, but I'm getting better. And your body will respond. They show this with plants. They show this with babies. They show this with animals. Why are we any different?
And Liza, one of our group members, she talked about that, how she does self-talk because she's got the, you know, issues. And so she tells her body, you know, we're going to do good today. And she says it's working for her. So it works, you know, having a positive mindset. One of the things that I learned from you that I live on now are the mushrooms. So I've got like all the mushrooms here that I use, the powder mushrooms formula. And so that was a takeaway that I got from you. And I do vitamin C, of course, multivitamin. So that's what I do to help me get through it. And of course, a lot of rest and pacing myself. But I think one of the biggest things that I learned from you was that mindset, the positivity, and doing something joyous for yourself. Because when I first came to you, you know, I was just in a difficult situation because I was really upset about being ill. And that really just, from that point on, that really just helped me hearing, you know, somebody else say that to me, that this is what you need to do. And it helped get me on the right path. Definitely.
It's a game changer. It really is, because it's a multi-prong approach. So you take the medicine, you take what the doctor gives you, you work on your mindset, you work on your nutrition. With chronic medicine, there is not one answer. I know that they're going to say, oh, we're going to come out with this one magic pill. And I even tell my patients this, I can give you all the herbs in the world. But if you're eating McDonald's and junk every day, it's not going to go that far. Or if you have a negative, hateful mindset, it's not going to go that far. So this is like day one that I work so much with mindset, because that's actually the secret. Mm-hmm. That's the deepest level that you can get, because otherwise I have some people, they will not change, and I'm like, okay, then you're just going to stay with me until one of us leaves. You know, you're a lifer. because you don't want to change, and I'll just keep you going with everything that I do. So changing the mindset, changing the lifestyle is huge. And getting professional help. That's one of the most painful things that I see, and I get it. And like my colleagues and I, we talk about this a lot with the long haulers. We feel like it's a disconnect. We can help you. We have the ability, we have the tools, but we can't say it because there's like anyone who says that they can do anything beyond what is conventional medicine is being quieted. So I can't tell you, like I can't make an ad, say, hey, come to me. When we go into the groups, a lot of my colleagues have said they've left because they're like, it's just too painful to watch. Everybody's self-treating each other without Google's not going to help you get through something as serious as this. It'll help you a little bit, but not to the level that you could be, So you have enough to worry about and not to worry about. You have enough to focus on with getting better. Let someone who knows the ropes guide you. It's hard to even just follow the path, to change the lifestyle, to change the mindset, but to know the dosages, what the correct things are. I was in school for 5.5 years and I've never stopped. Like, I don't know how many long hauler. I think I've taken like 5 or 6 now. There's not that many, but they're coming out for long haulers. It's building.
How many patients? How many long COVID patients have you treated?
Probably a handful. Like about I would say like maybe 8 or something like that. The acutes though, because LA is on fire, so you have to look at where I am.
Mm-hmm.
The acutes, I'm over 50.
Okay.
Easy. So it probably in about 3 months or 4 months, and they're already starting. I just had another one today. So it's like where I am and where it's hitting, you know what I mean? And everyone under my care, nobody's turned into a long hauler.
Okay.
None. Everybody actually, I've had a few people say, I feel better than before I got sick. And that's always my goal.
That's awesome.
Yeah. So I learn, but I want more. I want like the really hard ones. Like I love a hard case. I want like some really, 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 really hard ones. But
of the 8 that you have, are they all women? Yeah. Yeah. Okay.
Yeah.
Okay.
Yeah. And I would say out of the demo of everybody I've treated in total, I would say 90% have been people of color.
Yeah, because you said most of your practice is made up of African Americans, right?
Mexican. In normal practice, we're diverse. We're an equal split.
Okay.
Socioeconomic and in race, but mostly women. Always, women love alternative medicine, but I have quite a few men too. So I treat everyone pretty much. You can find the most totally different people in my waiting room, and they make friendships. That's really cool to see people from different areas in LA become friends. So, but with this pathogen, it's been predominantly minorities.
Gotcha.
And that's who's the hardest hit, right?
So it's to be expected. Yeah, absolutely. And let me ask you this, because we're getting ready to close up here. If you were, because we just got a new CDC boss. So let's say they had given that job to you, the CDC director. What would have been your first, or what would be your first order of business?
Well, I mean, of course, I would, all the focus is on vaccination, so that would have to continue.
Mm-hmm.
Public education.
Public education would be
Public education is the winner, because that is why, in my opinion, America is dying right now, and we're raging, where you see Africa and Vietnam and other countries that invested in public education. Mm-hmm. Really were able to control their numbers. So I would go to the source and keep people from even getting this. But then if from there, for the people that have it, I would use people. We're all waiting. We're like sitting there. We want you. Like, we can't say we can help you. So it's very frustrating for us. And I would like to ask you guys, like, what's the disconnect? How can we, because I have from two different sides, I see the long haulers saying they're frustrated and they need help. And then I go into my professional groups and they're saying, we want them, we can help them, and we're sidelined. Like, how could we get that together? That's what I want to know. And if I was in charge, I would do that, because if I were to get people the moment they test, if me and the colleagues that I know that are working on this, hospitals would not be overloaded. Of course, there's the people. I can't help everyone. When one of my uncles got it, I told my family, the moment I found out he had it, I said, we have to prepare, he's going to go. I didn't even try to give him anything. I already knew, with all of his pre-existings, with everything going on, there's some people that the only way to protect them is to keep them safe.
I gotcha. Yeah. So that's powerful, and I'm really sorry to hear about your family members. But I thank you for coming on and talking with us and sharing your knowledge. And you do this daily. Our group is very informative, so you're keeping us up to date, and we're all doing that collectively. So that's just great. So I appreciate it. Is there any other take-home message that you want to give? Is there you got a last one for us?
Build a team.
Build a
team. Get a good team. Get a doctor that listens to you. And if they don't listen to you, find another one.
Get another one. Yeah.
And just go shopping for them. Get a really good doctor. Get everything scanned. What's your heart function? What's your lung function? What's going on with these organs? Check your kidneys. Check your blood vessels. Are you clotting issues? Is there damage? What is it? And then the next thing is build a team where you have someone like me. You can do an ND. They operate a little bit differently, but I was also trained by an ND, and I will say that there is power in supplements, and I absolutely use them. Get some professionals on board. If you have trouble walking and with balance, get a PT. If you are having, pain, get a chiro. Build a good team, because that's one of the first things I do with my chronic medicine patients is I build a team.
Yeah, absolutely. I can say that personally speaking, I did that, and it helped, because I ran into a lot of doctors who just weren't listening, and a lot of women in our group have said the same thing. So I think that's an excellent closing statement. So awesome.
Thank you. Take care.
It was great.
Yeah, for sure. And I'm always here. So just tag me if you have a question. I'm always willing to help.
Absolutely. So
one more thing. Mm-hmm. The practices we did for like the lung, heart, kidney, all of those, I'm going to start a free series on Instagram soon, going through all the organs.
Okay. You want to give your Instagram a shout out?
South Bay Total Health. My business is South Bay Total Health. So we'll be starting the series. I was wanted to do in the first, but I got a little overwhelmed with the acute cases, but things are kind of calming down here in LA, and I'm ready to go. So we'll go through all the systems, which also balance organ and emotion.
Sounds great. Awesome. Yeah. Looking forward to it.
All right. Wonderful. Yeah. Thank you for having me.
Thank you, Christy, for coming.
Thank you for this group. I love it.
You guys.
Thanks, bye.